Cardiac asthma is a condition where you experience asthma-like symptoms, particularly wheezing and difficulty breathing. However, unlike regular asthma, which is caused by lung issues, cardiac asthma happens due to heart problems. Specifically, it occurs when the left side of your heart isn't working properly. Your heart's left ventricle is responsible for pumping oxygen-rich blood to the rest of your body. When it becomes weak or doesn't work efficiently, it can't pump blood forward as well as it should. This causes blood to back up into the lungs, leading to fluid accumulation in the tiny air sacs, or alveoli, in your lungs. As these air sacs fill with fluid, they can't function properly, making it harder for oxygen to enter your bloodstream. Your airways may also become constricted due to this fluid buildup, causing wheezing sounds similar to those heard in bronchial asthma. Think of it like a backed up sink. When the drain, or your heart, isn't working properly, the water, in this case fluid, starts accumulating where it shouldn't. The key thing to understand here is that cardiac asthma is actually a symptom of heart failure, particularly left-sided heart failure. This is why it's sometimes called cardiac pulmonary edema, or heart failure with breathing difficulty. Cardiac asthma primarily affects older adults, particularly those over 65 years old. It's seen in about 20 to 30% of patients with heart failure and becomes more common as heart failure progresses. Causes of cardiac asthma. The underlying cause of cardiac asthma is always related to heart problems, particularly those affecting the left side of the heart. Here are the main causes that can lead to cardiac asthma. Number 1. Coronary artery disease. This is the most common cause of heart failure. It occurs when the arteries that supply blood to the heart become narrowed or blocked. This causes your heart muscle to become damaged and weakened, affecting its pumping ability. Number 2. High blood pressure. Untreated high blood pressure for a long time can cause your heart to work much harder than it should. Over time, this extra strain can weaken the heart muscle, leading to heart failure and cardiac asthma. Number 3. Heart valve problems. Problems with the heart valves, particularly those affecting the mitral or aortic valves, can disrupt normal blood flow and cause backup into the lungs. Think of it like a faulty valve in a pipe system. When it doesn't work properly, flow gets disrupted and backup occurs. Number 4. Heart attacks. Previous heart attacks can damage the heart muscle, reducing its pumping efficiency and potentially leading to cardiac asthma. Number 5. Cardiomyopathy. This is a disease of the heart muscle that can weaken or stiffen the heart, making it harder to pump blood. Symptoms of cardiac asthma. The symptoms of cardiac asthma can be quite similar to regular asthma, which is why it's sometimes misdiagnosed. Here's what you might experience. The most noticeable symptom is difficulty breathing, especially when lying flat. Many people find they need to prop themselves up with several pillows to breathe comfortably at night. This is called orthopnea. You might also experience paroxysmal nocturnal dyspnea, which is a fancy way of saying you wake up suddenly at night feeling short of breath. This often happens a few hours after going to bed. Another common symptom is wheezing, a high-pitched whistling sound that occurs during breathing. Here, it might sound similar to asthma wheezing, but it's caused by fluid in the airways rather than inflammation and bronchial constriction. You might also notice a chronic cough, often worse at night or when lying down. The cough might produce white or pink, frothy sputum. Patients with cardiac asthma also experience fatigue and weakness, as your body isn't getting enough oxygen due to the compromised heart function. Swelling in your legs and ankles might also occur as fluid builds up in your body due to poor heart function. Finally, many people experience rapid or irregular heartbeats, and you might feel like your heart is racing or skipping beats. Diagnosis of cardiac asthma. Diagnosing cardiac asthma requires careful medical evaluation to distinguish it from regular asthma and other conditions. Your doctor will typically use several methods. First, they'll take a detailed medical history, asking about your symptoms, when they occur, and any history of heart problems. They'll want to know if your breathing problems are worse when lying down or during physical activity. A physical examination comes next, where they'll listen to your heart and lungs with a stethoscope. They'll check for fluid in your lungs, listen for abnormal heart sounds, and look for signs of fluid retention in your body. Imaging and diagnostic tests play a central role in confirming the diagnosis. A chest x-ray can reveal fluid buildup in the lungs and an enlarged heart, which are common findings in cardiac asthma. An echocardiogram, or ultrasound of the heart, provides detailed information about the heart's structure and function, including the efficiency of the left ventricle and the condition of the heart valves. An electrocardiogram is also often performed to detect arrhythmias or evidence of a previous heart attack. Blood tests, such as B-type natriuretic peptide levels, are also very useful in distinguishing cardiac asthma from bronchial asthma. Elevated BNP levels indicate heart failure. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment for cardiac asthma. The treatment of cardiac asthma focuses on addressing both the immediate breathing problems and the underlying heart condition. Here are the main treatment options. Number 1. Medications. Medications are the cornerstone of heart failure treatment. Your doctor might prescribe diuretics or water pills to help remove excess fluid from your body and reduce the strain on your heart. Other medications such as ACE inhibitors, beta blockers, or angiotensin receptor blockers can help improve heart function and prevent further damage. In some cases, medications like digoxin or ivabradine may be used to strengthen the heart's contractions or regulate heart rate. Number 2. Oxygen therapy. If your oxygen levels are low, your doctor might recommend oxygen therapy. This involves breathing in oxygen through a mask or nasal cannula to help improve oxygen delivery to your body and relieve shortness of breath. Number 3. Lifestyle modifications. This is a crucial part of treatment that involves making several changes to your daily life. To prevent fluid buildup, your doctor might recommend limiting your fluid intake. This can help reduce the workload on your heart and prevent symptoms like swelling and shortness of breath. You will also need to reduce salt in your diet and maintain a healthy weight. Regular, moderate exercise, as recommended by your doctor, can help strengthen your heart. You'll also need to quit smoking if you smoke and limit alcohol consumption. These changes can significantly improve your heart's function and reduce symptoms. Number 4. Surgery or devices. In severe cases, surgery or medical devices might be needed to treat the underlying cause of heart failure. For example, a coronary artery bypass graft can improve blood flow to the heart, while a pacemaker or implantable cardioverter defibrillator can help regulate heart rhythm. In advanced cases, a heart transplant or ventricular assist device might be considered. At the end, it's very important to seek immediate medical attention if you experience sudden or severe breathing difficulties, especially if accompanied by chest pain, rapid heartbeat, or pink, frothy sputum. These could be signs of a medical emergency requiring immediate treatment. Remember, while cardiac asthma can be serious, it can be managed effectively with proper medical care and lifestyle changes. The key is getting an accurate diagnosis and following your treatment plan consistently. Now, we want to hear from you. Have you or someone you know experienced symptoms of cardiac asthma? What lifestyle changes or treatments have worked best for you? Share with us your experiences and opinions in the comments below. We'd love to hear them. Thanks for watching.